Hello, everyone, and welcome to this installation of the Lion's Den. I'm Dr. Ashanti Carter, and I serve as the Director of Community College Partnerships at Charles R. Drew University of Medicine and Science. You guys, this is National Public Health Week, and I am delighted, privileged, and honored to be joined with Brothers in Public Health. This is a wonderful organization that I actually found on LinkedIn. So it pays to check your LinkedIn account, you guys. You never know who you're going to see on LinkedIn. And they have been gracious enough to come and kick us off, right, with National Public Health Week. As you know, yesterday was the first day of NPHW. But we at Charles R. Drew University of Medicine and Science, we wanted to invite these gentlemen as they talk about the future of public health. I know that's the last theme, but you know how we do here at CDU. It's all about just, getting the good stuff, getting into the conversation. So I do have an announcement to make. As you know, April is DEI Awareness Month. For those of you who do not know what DEI stands for, it stands for diversity, equity, and inclusion. April is also Financial Aid Awareness Month, and it is also California Community Colleges Month. So you're thinking, okay, Dr. Ashanti, why are you saying that to us? Well, I'm saying it because on Thursday, April 25th, CDU is hosting its inaugural Transfer Fest. Yes, that's right. I said it, Transfer Fest. So if you're interested in pursuing a career in healthcare, Charles R. Drew University of Medicine and Science should be your number one choice. So from 9 a.m. to 3 p.m., we will be having just like a day full of food, fun, festivities, and all of that fantastic information about financial aid, the careers that you can go into, and also research. So without further ado, you guys, so just join us, spread the word about Transfer Fest. So enough with the announcements. Let's go ahead and dive into our conversation. All right, Dr. Myles. Oh, you know what? It's the future because you seem like Dr. Myles Davenport. So we're just gonna go ahead. That's just some confirmation there. So, Mr. Davenport, please introduce yourself to the people.
Thank you, Dr. Carter. It's a pleasure to be here in Lion's Den and to meet you all during National Public Health Week. My name is Myles Davenport. I am a epidemiologist at the Office of the Chief Medical Examiner in Washington, D.C. And I also serve as president of Brothers in Public Health. That's just a quick introduction about myself. I'm sorry. Yes, pleasure to meet you.
Thank you, Myles. Winston, introduce yourself to the people.
Absolutely. Thank you so much, Ashanti or Dr. Carter. Hey, everyone. My name is Winston Wellington Wright. I currently serve as Program Manager of Diversity, Equity, and Inclusion at BJC Healthcare in St. Louis, Missouri, one of the largest regional healthcare and hospital systems in the United States, and also serve as Vice President of Organizational Development and one of the co-founders of Brothers in Public Health. And very excited to be here this evening with you all.
Thank you. Dr. Michael Whittier, introduce yourself to the people.
Hello, everyone. I'm Michael Whittier. I serve as the Director of the Office of Health Equity, Diversity, and Inclusion at UCLA Health. We are an academic medical health center right on the west side of LA and Westwood. We have 5 hospitals and over 200 clinics, and we are the largest employer in the state of California. And so, as you can imagine, a lot of health equity work, a lot of just equity and inclusion work within our organization, but then also a lot of work as it extends to our community and public health as well.
That's right. And UCLA is actually a friend and collaborator with Charles R. Drew University of Medicine and Science. We collaborate on various issues, various programs, various research grants. So it's a pleasure to have you here. All right, so let's get into it. Myles, Why did you form Brothers in Public Health?
I think we all the gentlemen on this call can resonate with me when I say there really isn't a role model in healthcare for us. I mean, we face a lot of the worst healthcare outcomes, but unfortunately, when it comes to those who are interested in working in healthcare or public health, and we're going through the schooling, we don't necessarily see anyone who looks like us. I know that personally, and again, I'm sure we all can agree that if we had someone there that we can look up to as a role model, perhaps it would have been much easier on us. We would have been able to dodge a lot of bullets along the way. So that's really the main reason.
Yeah, yeah, I was reading once a report that talked about the number of BIPOC people in healthcare fields. And I believe for physicians, we're a little under 6%. And then for all other healthcare careers, we're around the 2%, 3% mark. And then for PhDs, I believe we make up 2%. So you are absolutely right. We need more people who look like us, who can really be that guiding force as we're pursuing our careers. So, Winston, can you talk to us about the mission and vision of Brothers in Public Health?
Absolutely. And I'll be really succinct with this response in particular. So our mission is to increase the involvement of men of color in public health to advance the field, culture, and perception, most importantly, of public health amongst communities of color. And our vision is a world in which men of color are true change agents for the liberation and full health realization of communities of color. And just to add on a little to what Myles said, we really were inspired by all of our educational journeys. As an e-board or as the co-founders, we all have our Masters of Public Health. And oftentimes we're the only Black men, specifically in the rooms that we occupied. I'm a little different because I had the opportunity to go to Morehouse School of Medicine to get my MPH in Atlanta. But even then, out of a cohort of 27 people, only 8 of us were Black men. And then it took me to be a professional and get a, corporate job to meet someone like Dr. Whittier here and really have him serve as a role model. So I really didn't get a chance to see a lot of people until I moved on up the ladder. And we know that a lot of men of color will not have these opportunities based on all of the things that we face in the United States. And so that's our mission, that's our vision, and we are here to create a world in which public health is normalized in the hood and where our brothers in the hood are really the change agents for the industry in the field.
Wow, thank you. Thank you for that. So, Dr. Whittier, I know you stated that, you know what, I'm not a part of the organization, but I'm an ally. I want to help. What drew you to this organization to say, you know what, I'm here with you?
Well, it's aligned values and aligned purpose, and so I've had the pleasure of meeting Myles most recently. However, I have worked with Winston for quite some time, and we share a commitment to address inequities in our community, both in healthcare outcomes, but then also in representation in healthcare leadership. And so that alignment automatically drew me to supporting the work that Winston was doing and what he was committed to. And so I'm honored for him to reach back out and ask me to be a part of this panel. And it really is just is that shared vision to see our community grow, prosper, and thrive. And that should be at the center of everything that we do as healthcare professionals, our public health, global health professionals. But the reality is all of our service-oriented industries in some way, shape, or form impact the health and well-being of our communities. And so for the most part, there are many people that are public health practitioners and don't even realize it.
It's true. I was one of those people. I was a teacher in our juvenile justice system and didn't know that education is actually a social determinant of health. So, yeah, I mean, it happened. So, thank you for that. So as I stated, I serve as Director of Community College Partnerships at CDU. And so we may have some students who are watching. And of course, I would be remiss if I didn't ask you about your own academic journey. So starting with you, Myles, talk to us about your academic journey from college to your current career.
Sure. So I think a lot of people who are in public health sort of have this experience where they wanted to pursue one field and kind of wound up in public health. And for me, that was being a physical therapist. So pretty much my entire academic career from high school through undergrad, I was prepping my resume to be a physical therapist. And I wanted to be a professional, I wanted to work with professional athletes. Um, and I kind of noticed towards the end of my uh, undergrad career that this is probably not where I see myself being for the rest of my life. But I was still working towards it. I didn't get in the first round applying for physical therapy school, so I was retaking some prerequisites, and I kind of like recanted on a externship that I was participating in undergrad at Kennedy Career Institute in Baltimore, in a partnership with the CDC. And that actually exposed me to the broadness of public health. So although I didn't get into PT school, I decided to kind of explore that option a little bit more deeper. And from there, I was able to be selected into a competitive 2-year program with the CDC called the Public Health Associates Program. And that really jumpstarted my career. I learned a lot about just working in community, not community service, but in clinic. I was working in STD prevention, I'm sorry. And then from there, I went into tobacco product regulation and now working as an epidemiologist. So it's been an interesting journey, but that's how I've gotten to where I'm at now.
Oh, amazing. So pivoting, it was good for you, right? So for those of you out there who are thinking, man, I just, it isn't working out. I don't know. There's nothing wrong with pivoting. There's nothing wrong with that. Nothing wrong with it at all. I had to pivot and look at me now. I like where I am. So Winston, let's turn it over to you. Talk to us about your academic journey and your career.
Absolutely. So as Miles alluded to, I also discovered public health when I was on a traditional path to become a primary care physician. So I went to, into undergrad thinking that I would be pre-med, biology, and then, become this doctor that serves the community. And I must say, Miles, Dr. Whittier, myself, we're all from, the inner city, Philadelphia is a city that I represent, of course. And so I also always had aspirations to just have a really holistic, more population level impact in my career. And so towards the end of my freshman year in undergrad, I was like, I don't know if I'm going to be able to do that being a primary care physician, right? It's, one-to-one patient interaction, could get burnt out really quickly. And at the time, I thought doctors were the bad guys as well. I have to admit that had a little bit of radical energy, but I've learned quite a bit since then. And so, I said to myself by the beginning of my sophomore year, hey, I'll do biomedical engineering. I'll, do some innovative R&D for, manufacturing devices that, impact Black folks with chronic disease. And that was going to be kind of my vision. And one day in my Gen Bio 2 class, Morehouse School of Medicine's Master of Public Health program came to present to us. I actually was a student at Fisk University, so a double HBCU graduate. Um, and, when they were explaining what public health was, I was like, oh, this is it. Like, this is the dream. This is the vision. This is what I want to do. So graduated from Fisk with my bachelor's in biology. And then again, was fortunate enough to be accepted to Morehouse. And, I thought to myself when applying to Morehouse, what better place to really understand how to impact my community other than Atlanta, right? Which is a place that's hailed as the Black Mecca, but is also one of the cities that has the largest income inequality in the country. And so, you're around an extremely Black environment, but you're also seeing a lot of impoverished, homeless Black families. And Morehouse sat right in the heart of what's called the historic West Side. So we were always partnering with community-based organizations, really taking theory into practice right outside of the school doors. At the same time, I knew for my career, I wanted to be in hospital or health administration, wanted to wear a suit, be in an office, because the way that I looked at healthcare was like, hospitals and health systems are kind of the largest stakeholders when it comes to the provision of care, or at least in the US health system. So if I'm going to make my impact, I want to make my impact in that kind of institution. So I was fortunate enough to secure an internship with the Institute for Diversity's and Health Equity Summer Enrichment Program and landed at Duke University Hospital for a summer in the office of the president. And then there met one of my mentors, Rhonda Brandon, who was a big time healthcare executive actually in St. Louis. And she put me on to Barnes Jewish Hospital. And that is where my wife was doing her PhD at the time. My then girlfriend, but now wife, was doing her PhD at the time. So I applied to something called an administrative fellowship. So similar to Myles, spent 2 years serving under hospital leadership, so executive and senior leaders at the hospital, really learning what hospital operations were. And this was from 2019 to 2021. So, of course, right in the middle of that was COVID-19, which really shook up my world and said, okay, I got this MPH now. So I got to do something about it. And at the same time, the summer of civil unrest due to the murders of Ahmaud Arbery, Breonna Taylor, and George Floyd also really is when a lot of this DEI work started to kind of spark across the country. And Dr. Whittier knows this, being in a place like St. Louis, you see a lot and you think you know a little bit about health inequities and racial inequities. Then you go to the Midwest and it's like, oh, okay, this is what this really is. I don't know nothing. So it was a great place to get my training wheels, and I've been with the organization that I started as an administrative fellow, going on 5 years now. So that's just a little bit about my academic to career journey.
Wow, thank you. Thank you for that, Winston. All right, Dr. Whittier, talk to us. Talk about your academic career and all that good stuff.
Yeah, I feel like the old man now, so it's a long story. But similar to Miles and Winston, I too was on the pre-med medical school journey as well. And I actually got into the medical school of my dreams. I got into Meharry, and the semester before I was supposed to start, actually, I got a mentor at the hospital that I was working at. Little context: I was a college athlete. A lot of time spent focused on that. Took a deferment year to be able to go back to St. Louis, which is where I'm from, which is where I met Winston. And during that year, a mentor was just like, Michael, you want to practice medicine, or you want to be a doctor, you don't want to practice medicine. And she was the VP of quality improvement at a competitor health system in St. Louis to Winston. And she really was sharing something similar to what Winston had, or that reckoning he had his freshman year, which was I had the passion, the desire to have large scale population level impact, to impact my communities, impact the things that I was witnessing within my family, within my community, and more extended family. And I wouldn't be able to do that in those one-on-one interactions. And so she convinced me to start my master's in healthcare administration, literally the semester before I'm supposed to start medical school. And the program director was like, hey, you can start, stop, come back, finish your master. They made it really sweet for me and made it hard for me to say no. And this was right around the time the Affordable Care Act was passing, all these different things that was in our environment. And I just fell in love with it. My first My first class was a strategy course that was rooted in policy and advocacy, and I just fell in love. And I said, this is exactly what I'm supposed to be doing. And I decided not to go to medical school. And so fast forward to 2014, August of 2014 specifically, August 9th, 2014. I remember the exact date. I remember where I was. That was the murder of Michael Brown. And that kind of changed my life in many ways, because shortly after that transition into administration, I had the opportunity to seek out different opportunities outside of the hospital. I went into a community-based healthcare intermediary that coordinated access to care throughout the St. Louis region and across the state. And the Ferguson Commission appointed director by the governor was the CEO. And so at the time of her returning back to the organization, I was coming into this new organization, and I had the opportunity to do a lot of public health work, systems transformation that was related to the charges and data that came out of the research done after the murder of Michael Brown. And so that really is what propelled me into this work. I've always done diversity, equity, and inclusion work in some way, shape, or form. It wasn't called that. But I don't even call myself a DEI practitioner. I call myself a systems transformation leader, and recognizing that the work that we're doing is improving the quality of care, improving the quality of systems, so that people just have a fighting chance to live their best lives. So that is my work in a nutshell. I got recruited to UCLA Health after the pandemic, after we won Medicaid expansion in Missouri. So the fight continues here in this work, and I'm blessed and honored to be doing it.
Thank you, Dr. Whittier. So I just wanted to just have a follow-up question, because you pricked my ears about DEI, and as I stated at the top of the introduction, that April is DEI Awareness Month. And as all of you all know, just on the panel, there's a war on diversity, equity, and inclusion. So, Dr. Whittier, how can we do health equity work when there is a war on DEI?
I love this. I think this is my first time having an opportunity to have a public conversation about it in this way, and so hopefully this is a treat for all the attendees. The reality is there isn't a war on DEI. What we are witnessing is white supremacy in its truest form. And from the genesis of this country, from the first ship that sailed across the Atlantic, there has been an intentional attack on Black bodies to leverage scientific medical racism in order to justify the things in which they were, particularly which rich white men were doing. And we know that it was unjust, it was inhumane, it was just absolutely grotesque. We don't need to get into the history. And so when we see progression, when we see protests against the injustices, there has always been a counter protest to every injustice. You look at civilization, you look at humanity, no matter what continent you've been on, whenever there was an injustice and people protested, there was always counter protests, whether it was policy or if it was all out war. And so what we are experiencing is a counter protest to the progress, to the fear that the status quo is going to continue to be disrupted, because the reality is, in my strong and honest opinion, the election of Donald Trump was a counter protest to the first Black president, not only being in office, but having one of the most effective presidencies in this country's history. And so when we talk about war on anything, don't be discouraged by the news cycles, by the fear, by the media. If you go back to the 60s, it seems like it's so long ago. It wasn't really long ago. Majority of the country didn't agree with the civil rights movement. They thought Martin Luther King and peaceful protesters were violent. And so you see this rhetoric time and time again. You go back to the founding of this country where Benjamin Franklin was advocating for health equity and policies that got enslaved Black people health care and poor white people health care. And the counter argument to that was the democracy is too young and fragile, and we don't have enough money. And what is the argument to access to healthcare today? It's socialism, and we don't have enough money. And so we are seeing these cycles repeated time and time again. They just take a different form. And so I don't see a war on DEI. I just see whiteness in its truest form when it's trying to be leveraged as a way to maintain power and to leverage supremacy. And that's the honest truth for me.
Thank you. Thank you. Thank you for your honesty. It is well appreciated. I know your time is limited. So one more. You said a lot of things, especially as it relates to whiteness. Our education system is rooted in Eurocentric values and so forth. So, I mean, but we have to go to school if we want that master's in public health, right? So then Dr. Whittier, what can public health programs do to educate future practitioners in the truth about the founding of this country and health equity? Because, I mean, if we really look at the research, rural white folks, their health outcomes are similar to urban Black folks. It's the same. Broke is broke.
Mhm.
So,
Yeah,
what can we do with our future programs?
I think the reality is rooted in history, rooted in policy, and unfortunately, my colleagues at times where I was teaching at academic institutions, other partners in the community and in the organizations I was working with, they don't really even know it. And so you can't expect people to teach something that they don't know. And so it is a challenge, and we must reconcile with the reality that a lot of these things we haven't been taught. And so, what does uncovering the truth look like and integrating it into a curriculum? What does acknowledging the truth and reconciling with the reality and integrating it into curriculum in a way that empowers people? The issue with a lot of courses and DEI programs is it's like it's not solutions oriented. And that's why I say I'm focused on systems transformation. And so curriculum should be building leaders to transform the future of public health, to transform the future of healthcare. And the reality is these issues have been going on for some time. There's a couple reports that I'll throw in the chat, but to err is human, crossing the quality chasm and unequal treatment, confronting racial and ethnic disparities in healthcare. The first one, 1999, the second one, 2001, the third one, 2003. And all of these reports highlighted inequities at the systems level, not at the individual level. I don't care about the interpersonal bigotry that people carry. I'm not going to be able to change the worldview of people. However, I can create a system in which doesn't allow for bigotry to be input into it and then impact the outcome. And so that is my work. And that's what I hope that administrations and universities do is put people in place that can help our future leaders understand policy, understand quality improvement, understand systems transformation, so that we can continue to weed out the injustices. Because the statistic or the note you made around poor rural whites and urban Blacks, the reality is racism has put the United States in a perpetual recession. We don't have economic opportunity of Black and brown people across this country, and that actually limits our economic viability. It actually limits our ability to be the healthiest, most thriving country in the world. And until we reconcile with that reality, we're always going to see the injustices, see the inequities. And then lastly, a very pointed statistic. Yes, we know Black maternal health is an issue, but when you look at Black maternal health in relation to all other countries, the next demographic that is right next to Black women are white women in the United States, and then there's every other country in the world. And so racism has really hampered our ability to thrive as a country, and we just have so much work to do. I look forward to coming back and having this conversation with you all again, maybe a part two. I do have to run, but again, thank you for having me. And if there's any follow-up questions, Dr. Carter, you have my contact information. Happy to answer any questions that the students may have.
Thank you so much, Dr. Whittier. Take care.
All right.
All right. So Winston and Myles. Wow, that was great. So that leads me into brothers in public health, right? So what is it that you all are doing in the DEI space? But now I want to flip it as anti-racism work. So I'll start with you, Myles.
Sure. Appreciate the question. So what we're doing to sorry, having a moment. What we're doing in support of anti-racism, I mean, I think we're doing it just by organizing as an organization. We're trying to create spaces for us to come together, recognize the issues that we face in our own ethnic backgrounds, and creating space for us to have a place to conversate or communicate with one another, but also go out into our communities and make an impact. Winston and I were kind of talking about this a little bit earlier, and we're just, you know, the initiatives that we have in the works moving forward have a lot to do with anti-racism, making sure that our presence is known, and that the work that we're doing is very important because, like you mentioned earlier in the call, there aren't a lot of us in this space. Black, even though, you know, looking at the numbers, Black appears to be doing a lot better than the rest. The other races are still suffering a lot worse than us. So just shedding light on that issue is what we're doing.
Thank you. Thank you. Winston, you want to jump in and add?
Yeah, absolutely. So it's actually been quite amazing to be able to see the impact that we've been able to have as a nonprofit organization in such a short amount of time in terms of just bringing young brothers together. We have conducted two focus groups to kind of review our strategic plan for 2024 and 2025. And the main piece of feedback that we get from other young Black and mainly Hispanic guys like Myles and myself are like, yo, we've never even had a space to talk like this, to really talk about not only our career journeys and the fact that, you know, it was a lot of white women in a lot of our classes and conferences, um, but also the fact that we are typically the ones that are up on these charts when we talk about, you know, racial inequities in terms of health outcomes in the United States. We are at the lower end of the totem pole. And yet, there's not as many of us that are practitioners. So just creating that space to build that collective power and that collective action is one thing that we are very serious about. If anyone visits our LinkedIn or social media pages, we're big on content creation, but content creation that is very targeted and pointed and really is meant to encourage other folks to use their voice to talk about the issues. Because even when you get into your dream job or, you know, you get into grad school, you may find that people do not react to what you want to talk about in a great manner, in a respectful manner. They may be threatened or, you know, feel uncomfortable about the reality that Black men have to face, that Black women have to face, that Hispanic and Latino communities have to face, the American Indian and indigenous communities have to face in this country. And they will only become more real if we talk about them. So creating that collective action is a big thing. And like Myles said, we really feel like we are anti-racist because Black men are underrepresented in public health and healthcare because of racism. So we, are coming to the table to say we are here, we have a voice, we know we matter, and we want to show up and be the advocates for our communities.
Thank you. Thank you so much. So both of you spoke about just with your careers and even your academic journey during COVID. So the COVID-19 pandemic, it was awful, just with the BIPOC community, we were disproportionately negatively impacted with cases, deaths, all of that. So, just looking at, as you both alluded to, with Black men, Black women being on those charts, you guys, how did we get here? Like, how? I know Dr. Whittier, he talked about it, but I want to hear from you two as well. How did we get here and how do we move? Just with Brothers in Public Health, Charles Drew, Meharry, and even PWI schools like Hopkins, even, or where I came from, I worked at Hopkins and even at the George Washington University. How can we come on board to move from a whole lot of this to more action? I'll start with you, Winston, and then Myles. I want you to jump in.
Yeah, I'm gonna try not to be long-winded because I love this question, but I do want to start with a quote, if that's okay. In terms of how do we get here? And the quote is, ultimately, the public health epidemics produced by the elements of Black neighborhood destruction shorten the length of communal bonds. When people experience root shock, chaos escalates. When people lack resources, conflicts increase. When people are exposed to toxic lead, violence rises. When people are constantly worried about evictions and foreclosures, chronic stress is elevated. When people are being murdered and homicides spike, distrust multiplies. The cooperative work that is needed is unlikely to happen while multiple public health epidemics are raging like wildfire. And that is a quote from Lawrence T. Brown. It's a book, may not be able to see it, called The Black Butterfly, which is actually about Baltimore and racial disparities in Baltimore. It's a fantastic read. We just had a panel on civic engagement last night with another organization, and we all came to the conclusion that economic stability is the key social determinant of health. And Dr. Whittier said it in his response earlier. Black people have always been overvalued for their production and their work, but undervalued in terms of how they're compensated. And of course, we can go all the way back to chattel slavery in the United States of America. But oftentimes, I actually like to start at the Jim Crow era, right before the Civil Rights Movement, so 1900s to about the late 1950s. If we think about, this is another book I have to reference, Black Labor in White Wealth. This is by Dr. Claude Anderson. This is a fantastic read. He talks about how Black people moving into spaces where they could finally get some sort of job have literally always been undermined and undervalued economically speaking. So we've always had gigantic wage gaps that persist. And we know women in this country, unfortunately, Black women really are impacted by that disparity the most. So we live in a Yes, so we live in a country where, just because we are Black, we are more likely to not make enough money. We are more likely to work lower wage jobs. After the end of chattel slavery and the Emancipation Proclamation started, or was enacted into law, excuse me, many Black people took on roles of cooks, cleaners, house sitters. There was a time where, the Pullman Porter system where, Americans would travel by train. Black men were able to get jobs as porters. So, essentially being attendees to white people in really luxury style transportation methods. We've always had low wage jobs. And when you walk into my hospital where I work at, or any of the hospitals I work at, we still have low wage jobs. I would not be surprised even if at UCLA's hospitals, if Dr. Whittier was on to still speak to this, most of the Black, Hispanic population at those institutions probably are still making up the janitors and housekeepers. So that economic stability piece is huge because when you don't have the ability to gain the resources that you need to provide for your family, and we're talking about just basic needs, well, then how would you expect your children to be able to go to school, to be able
Right,
to afford college, to be able to pursue public health degrees and pursue their master's degrees? It's not lost on us that everyone on this call represents an extremely small slice of people of color in general. Just forget Black people, just people of color in general. So poverty, is really the big reason why we are here. The systematic entrenchment of communities of color in poverty and keeping them impoverished is a reason why we are here. And then it would be a missed opportunity. And I won't show this book, but I'll just mention this one, The New Jim Crow by Michelle Alexander. I highly recommend read. I'm sure it's something that
good book.
mostly everyone has read. But when we think about Black men in particular, men of color in particular, but specifically, focusing on Black men, mass incarceration was the latest tool to really keep us in our place economically. And you think about the injustices that are seen, Shanti, you've worked, in the justice population and, have had firsthand experiences. But even as brothers get out, and try to start their life, we know that there are so many different barriers, to them just being able to try to provide stability for themselves, let alone move up. So poverty is the root cause. That is the
Right.
disease. That is the main thing. And some people may not like this, but economic mobility
Yeah,
is really a key factor. We know that education is a protective factor for most health outcomes. Some things like maternal health, it isn't, unfortunately, but education as well. And so, really focusing on, our people having the opportunity to be able to just live life, and afford life, and not, have to survive but thrive in the United States, is really what we need to do, and is how we're going to get, things to change. And we hope that we grow into an organization that can provide scholarships, really starting at the high school level, and
right.
getting young men of color interested in public health, getting them skilled up so that they can enter these spaces and take
So
over.
Winston, why are you going to like you jumping ahead to like
Oh,
the
sorry. Sorry. I'll shut my mouth instead of trying to
excited?
be
Getting
long-winded.
excited. That was good. That was good. So, Miles, do you have anything to add? Like, how did we get here and how do we move the needle towards let's just stop with all the publishing and telling us how bad things are to we can look at best practices and look at, what's working.
Yeah, it's hard to top what Winston said. I feel like he covered everything. The examples I have kind of fit into what he just explained. But I mean, one of the things I was just thinking about how Black people historically we've been the guinea pigs, and we always kind of point back to the Tuskegee study, the syphilis study, and it's just created distrust in our community, unfortunately, to the point where um, you know, even if someone of color is interested in pursuing healthcare, someone in their family might be like, well, why? Just trying to shun them away from pursuing that. But even those who do make it and are successful and trying to actually show their community, hey, I'm here for the very reason that you are afraid of, that I'm telling you this is the truth. There's still that unfortunate um, clash there. So how do we get here? Just the historic racism, the it's unfortunate how our ancient practices of medicine um, in the motherland has not transferred over well in Western medicine.
That
So
part. That part.
yeah, um, so we're just trying to bridge that gap, and um, unfortunately, it's been an issue for years, but hopefully initiatives such as ours with the Brothers in Public Health organization, we're hoping to leverage our skills and ability to show that, hey, we're here for you, and we want to bring others up along with us so that we can make a change.
And it's really important just with the work that you all are doing here at Charles R. Drew University of Medicine and Science. We have a number of their pathway programs. They call them pipeline programs at Drew, but they're pathway programs for youngsters as young as pre-K. And they go all the way, yeah. So it's our Saturday Science Academy 2 program. They had junior white coat. So you have little 5-year-olds getting their white coat and taking pictures. And so that's one thing that I love about CDU is that it's really about paying it forward and developing the next generation of healthcare practitioner. Whether you want to be a physician, you want to go into public health, you want to go into medical imaging or nursing. So there's just a plethora of programs that one can choose from. And so I think that's a beautiful thing. So I want to talk to you. I want to go back because each of you talked about your experience at your respective college. So Myles, can you tell us a little bit about your public health program, and what is it just based on the work that you're doing now that you wish you were just kind of like, man, my public health program, I wish they would have included X. That would have helped me out a lot. And then we'll go to you, Winston.
Sure. So when you say what was my experience in the public health program, like, you want to know which exactly, like, how did I feel, or?
Yeah, I want to know it all.
Okay. Let's see. So I'll start back to where it all began. So I actually started my collegiate academic journey at a community college. And right off the bat, I can tell that, I mean, even in high school, um, growing up in a predominantly minority community, you can just tell how a lot of people of color don't take academia seriously. And going to community college, you kind of see that same trend. People skipping class, people just hanging out, not really um, doing their work. And when it comes to specific classes, like the more rigorous STEM courses or health classes, you just kind of see who's in those spaces or who isn't. Um, and so that made it difficult for me to see myself um, in those sort of spaces, specifically healthcare, because I know, like, it's only going to get worse um, throughout school. Um, but as I kept pushing, I've always been self-motivated. My father, he's an engineer, so I mean, he had been pushing me to be an engineer all my life. Um, but even though I didn't take that route, I still had that will and determination to succeed. So I was able to stick through it, and when I ultimately decided that I wanted to pursue my master's in public health, I kind of at that point knew what to expect, because I had already kind of been exposed to what public health is, and um, the environment and all that stuff. I will say, now working in my career, some of the I guess skills and courses that I wish were available to me at the time would have been more um, like application related. So in my
Mm.
job, I work a lot with uh, data visualization tools, and so there's some things that I wish I was exposed to then. But not to say my schooling wasn't helpful at all. There's a lot that I've learned, a lot that I've been exposed to that has helped me along the way. But for me specifically, in the work that I do now, there's a few things that I wish that was offered to me at the time. But um, yeah.
Yeah. So the data visualization. And so one thing that you did say that pricked my ears, you stated that in the community where you were, it seemed like the cool thing to do was to skip school. And the people who were doing that kind of looked like the people on on this panel. So that's something that I talk about when I speak with students, especially younger students. A lot of times we do get tricked, we fall for the okey doke where we see what's on television, we see what's on social media, the images that we see of what the culture is, right? And so, back in my day, yes, I'm a lot older than I look, but back in my day, the culture, it was going to college. So the people who look like me and my friends, we went to school. If you were out hanging out, doing nothing, we didn't like you. If you were a nerd, you were cool. If you were just out there just doing whatever, not getting your education, you were kind of like the loser. We didn't want to be around you, but it's gotten flipped on its head, right? So with that, it just shows how, where there's that protest of this is what we are, then there's that counter, right? Oh, well, do this. So even like with hip hop back in the day, there was a song that I included in my PowerPoint. It's called I think it's You Must Learn by KRS-One. And this is an old rap song from like 1988 or 89, right? And so the people in there, they were older, but then I'm like, what, you don't know this song? And then they're just, oh no, I've never heard this song. It's like, okay, because when you guys were coming around and listening to rap, it got flipped to gangster rap, just how many women you can get, how, being violent, the drugs and all of that. But the hip hop that I grew up on, it was more positive. And the storytelling was how to get ourselves out of poverty, not, being this anti-hero or so forth. Okay, but that's just me. So sorry for the little tangent. Winston, come on, talk to us about your public health program and what is it
Yeah.
that you have wish you had learned?
Yeah, so I actually I'll stick to grad school specifically. So again, proud graduate of Morehouse School of Medicine's Master of Public Health program, and it was a fantastic experience. Everybody was black, so you really felt empowered. You felt enfranchised, and one thing that I left Morehouse saying is like, wow, I was lucky enough to be able to develop my intellect in an unapologetically black space, which is something that not a lot of people get. And so actually, because Morehouse was that institution, and again, we were located in the historic West Side, I would often be able to take okay, a quick example. I did my master's level thesis on the association of marijuana use and depression among adults in the United States, particularly looking at African American and Hispanic men from the ages 18 to 26, right? Because you mentioned kind of how the culture is flipped. I'm from Philly, so we grow with the best of the best and the worst of the worst. So I try to keep it real every time I have, a platform because I want to make sure people know like I talk your language. Like, I know how to, talk a few other languages, but this is where I'm coming from. So I had the opportunity to do research, present it to my professor, and then walk 2 blocks over, go to the barber shop, talk with my barber, talk with the local dope boys in on the block in the barber shop and everybody else about their patterns of smoking weed and if they felt like they were ever depressed, or they ever had anxiety, and that led them to smoking weed. And I would literally be in my Morehouse, get up, my suit, my tie, and there would be dudes with face tats, all over their face, like, dang, bro, that's interesting, that's crazy, in good old West Side of Atlanta. And so I would sit there and be like, oh, this is what I want to do. Like, this is what I'm meant to do. Like, I'm among my people, but I have my voice, my identity, and this is what the collective Black economy of knowledge, anyway, looks like. So that's what I took from Morehouse, and that's what I still try to do in every single endeavor within my position now, supporting a health system in St. Louis. One thing, though, that I think that they did not prepare me for, and some of my professors try to do it outside of class, but I also consider myself progressive, like, quite left leaning. And again, I'm from Philly, so I grew up in a big city, so I know the hood, but I also know real cosmopolitan, diverse areas and all types of different friends. So when my professors would try to tell me like, yo, you're not ready for the white corporate world, you're pretty naive if you think these 50-year-old white people are about to be your friend when you get in this position. I was like, oh, Dr. Such and such, you're wrong. Like, the world has changed. Like, it's no longer like that. Like, y'all went to school back in the 60s. Like, you don't know what you're talking about. Um, and it hit me in the face. When I got into the real world, I would have instances where I would have to be facilitating a meeting and I would need like each of the directors' notes and their slides that are in the meeting. And I would have certain white directors ignore my emails, ignore me in the hallway when I would ask them for their work, ignore me when we were actually conducting the meeting, and would only talk to one of my white colleagues, wouldn't even give me direct eye contact. And for the first 4 months of my professional life after grad school, I was depressed. I was chronically depressed and really thought to myself, what did I do this for? I have a whole degree, 2 degrees, and this is how I'm being treated. Like I didn't, forget racism. This is just unprofessional. And what is this kind of hatred that exists in people's hearts? And so I think, there could be a lot done to really prepare students of color for, we call them microaggressions, but I feel like they're macro aggressions because they're done intentionally and
Yeah.
many times, and people just know how to be nasty in certain professional environments. And my wife even experienced this on the academic side, doing her PhD. There could be a lot more done on just how to maintain your mental health, use wellness as a tool to kind of not suffer from imposter syndrome when you actually are being attacked. And just staying strong. Luckily it was kind of baptism through fire. So after those 4 months, COVID happened. But then I also had to say, like, okay, like I gotta shake this off and speak up for my people. But that was probably the biggest challenge that I felt could have been more formalized. Like I said, a lot of my professors tried to pull me alongside and said, you're not ready for how this world is going to treat you. You're a bright, energetic, young man. You're really radiant, but that's not how they're going to see you in the workplace. You're going to be a threat to people. And I actually had a white leader tell me that I was a threat to them because they had never interacted with a black man in a suit or a young black man in a suit before. So that's something that I wish I could have got a little bit more training on, just how to really prepare to maintain my mental health in a corporate environment.
Well, I think that's amazing. So thank you for that, Winston. And with COVID-19, our mental health, it's really at the forefront, especially being students and students of color, our mental health is at the forefront. So, Myles, as the president of Brothers in Public Health, my friend, talk to me about your vision of not only the future of Brothers in Public Health, but the future of public health. And then we're gonna close it out with Winston. Go ahead, Myles.
Sure. So first off, I'm just so fortunate to have been able to connect with a dynamic, committed group of fellas such as Winston, as one of our co-founders, Omari Richens, who also known as the Public Health Millennial. Shouts out to him. Winston also has his thing. What is it called, Winston? Go ahead, tag yourself.
The healthcare hustle, but not needed. But thank you.
And then our last co-founder, Aaron Carpenter. And they bring a lot of skill and talent to the team. One of my favorite quotes is, if you're gonna go fast, go alone. If you want to go far, go with others. And this has kind of been a vision that I've had for several years, but I just haven't been able to have a team of individuals who've been willing and had the time to work with me to plan things out and really get things where they need to be. So I'm really happy to have that team there. As far as where I see Brothers of Public Health being the future, right now we're sort of in this digital space. COVID-19 has sort of transitioned a lot of people into working remotely with one another. And it's amazing how I've been able to connect with Winston. Haven't met him face to face yet, but one day we will soon. and working across different time zones has its challenges, but we really want to have a physical footprint in our community, whether it be in different universities around the nation, different metropolitan cities. And we really want to be able to be at a point in the organization where like communities know, hey, like if you're looking to get involved or you want to um, just do something good in your community, you can reach out to Brothers in Public Health. Doesn't necessarily mean that you're aspiring to work in public health. You just might want to do something that is fruitful and supports your neighborhood um, in a healthy way. So that's the future of us. As far as the future of public health, I really, really wish that, you know, I feel like there wouldn't be a conversation of public health if we were in a place where there were any um, disparities occurring. I don't know if that makes sense, but I just envision us in a place where we are able to effectively do our jobs, help one another, and have the best healthcare outcomes overall. I know it's going to take a long time for us to get to that point, but yeah, just really need to work together and provide resources to those who need it and share the word.
I love it. I love it. Thank you, Myles. Winston, bring us home. What's the future of Brothers in Public Health and the future of public health as a whole? Bring us home.
Absolutely. So the future of public health, as Miles said, is, we really are going to grow into having a in-person footprint in cities across the country. Again, we represent, the inner city for the most part where we're from. Miles from PG County, myself from Philly, living in working in St. Louis now, but living in Nashville. So our network, just through being on LinkedIn, being on Instagram is pretty expansive with other young brothers. And so it really looks like providing toolkits, providing resources, and extending and leveraging our brand so that they can enhance the work in their local community. So we're not quite at the stage of, chapter development yet, but that is going to be something that will take place later on down this year. And we want to be a totally different professional organization. We're a nonprofit, and there are other organizations very similar in terms of just maybe not focusing on our targeted demographic. But we've had a lot of conversation about, okay, how do we actually serve and how do we make service at the core of what we do, right? So if you look at all of our content, it is us talking about statistics, it is us being real, and it is us talking in the way that we know brothers talk, right? So we have plans to really extend into our Hispanic and Latino brothers, creating content in Spanish, highlighting the parallel history that have happened to their communities. So it's not lost on me. We're, talking to a lot of folks on the West Coast, thinking about the California eugenics program, how that impacted a lot of Mexican migrants, back in the day, and how there's still a domino effect of what that racism and form of racism has done on the community. But we also know that we got to bring our Asian American and Pacific Islander brothers into the conversation as well. So building that solidarity really is going to be the future for us. We were very intentional with our branding and how we started. We know that when people see the word brothers, they're automatically going to think Black men, but we want to be the group that says yes and others, right? Because we only represent 3.17% of master's degrees in public health, but the numbers are actually smaller for every other racial or ethnic category. So we're the biggest as Black men, and we're still small. So it's like, okay, we're the vanguard. We got to be the folks because there's more of us. We got to be the folks to reach out a hand and lift everybody else up. So that's the future of Brothers in Public Health. And then in terms of the future of public health, to have it actually represent the people that the research is about, right? I think, Ashanti, a lot of times it is just talk, 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 because the people who are doing that are not us. And we have these, one thing that has always been said to us since we started is, well, there's, community-based participatory research, right? And we're like, yeah, that's great. That's cool. That's a small brick, right? like bringing people in so you can, do a focus group and ask them some questions. Yeah, we're going to do that too. But we also want Mr. Johnson, and we want, Kareem, and, we want Jose. We want all of them to be able to be high school students, college students, talking about like, oh, you know why, there's a higher, rate of asthma in our neighborhood? Or did y'all know that we still got, lead paint in our apartment buildings? And I grew up in that building for 16 years. What's the, policymaker? What's our representative that we can call? What's an organization that can maybe, help us, talk about creating some content so we can educate our community? So we want, the future of public health to be representative of the people that are actually, being studied in the field. And in a country like the United States of America, that is people of color. So that is really, the world that we want to help create.
Thank you so much. So, all right, you guys, that was an amazing show. We're a little bit over time, but that's okay. That's okay. So I'd like to thank our esteemed panelists, Mr. Winston Wright, Mr. Myles Davenport, and of course, Dr. Mikel Whittier for joining us for our kickoff for National Public Health Week. Once again, I'm Dr. Ashanti Carter, and I wish you all well. Take care, everybody. Panelists, stay on. All right, bye.